All right, everyone. Again, this is Martina James Nally with the American Planning Association, the Virginia chapter. I am staff and help manage the webinar program that is sponsored by the Berkeley group called Your Hour with APA Virginia. You should see on your screen the conference website, so we'll keep that up there while I go over a couple housekeeping things to make sure you guys are aware of the upcoming annual conference. That'll be in Roanoke in July. But every month we have Your Hour with APA Virginia, as I said, sponsored by the Berkeley Group, which we are very fortunate to have them make this webinar series available. Again, all of our webinars are recorded and they are posted to our YouTube page afterwards. When you're watching the webinar live, you're eligible for CM credits, and if you have any questions about those, please feel free to reach out to me, and I can get any questions answered for that. This week we have Jennifer Senick, who will be presenting. She's the Executive Director at Rutgers Center for Green Building and the Interim Director of Development at Rutgers State University in New Jersey. Dr. Senick will be presenting the Plan4Health presentation today. Our next month's presentation is Carson Bice, and he will be presenting incorporating financial sustainability into comprehensive planning process, and that is Monday, March 27th at noon, as all of ours are the fourth Monday of every month at noon. And just so everyone has the opportunity to see, this is our YouTube page where all of the webinars are posted within 24 hours of the presentation. So thank you to the Berkeley Group. Thank you to Dr. Senick for being with us today. She has a video that she would like me to share with you all, so I will show this video and then I will hand it over to her. And here we go.
I'm here today to share a few highlights with you of the Trenton Healthy Communities Initiative, which over the past 18 months has sought to develop and implement a series of policies and systems strategies to help overcome challenges associated with physical inactivity and unhealthy diet in the city of Trenton, New Jersey. The initiative itself comprises a broad array of multi-sectoral partners, including researchers of the Planning Healthy Communities Initiative at the Bloustein School of Planning and Public Policy, the New Jersey chapters of the American Planning Association and American Public Health Association, the Departments of Planning and Health and Human Services of the City of Trenton, New Jersey, as well as the Trenton Health Team, a coalition of more than 40 nonprofits, including the area hospitals. Indeed, the multi-sectoral nature of this partnership has been instrumental in its successes.
Our project has four main objectives. The first is designed to advance the adoption of health-focused policies by incorporating health-related goals and strategies into the city's comprehensive plan update. We're also creating a first of its kind in New Jersey health and food systems element, which will become part of the city's comprehensive plan.
With the health and food systems element, we hope to see the city achieve a healthy, environmentally sustainable city that actively pursues strategies to improve and sustain air and water quality, enhance the ability to gain a healthy lifestyle for residents, increase access to healthy, affordable food.
Second, we hope to promote a health focus in local government decision-making. To do this, we met one-on-one with the mayor's cabinet departments, and we will be conducting a health and all policies training for city personnel. Third, we will broaden existing health partnerships in the city to include non-traditional health partners and expand health literacy among Trenton's residents.
The work that we have done with the Plan4Health Project has provided the biggest opportunity for us as a city and for department directors, with the support of our mayor, to focus on health impacts in policy-making decisions that we make day to day.
And finally, we will be sharing the lessons learned as part of this project with the broader planning and public health communities in New Jersey.
At the end of this initiative, with our template that we'll be providing municipalities, I believe we're going to be able to show municipalities across the state how health can be infused into their land use planning and zoning decision making throughout the state.
All right, so one more housekeeping thing before I turn it over to Dr. Senick for her presentation. If anybody has questions, we ask that you hold them till the end. You have a location in your GoToWebinar control panel where you can type questions in. The easiest way we suggest to do that is type your questions as the presentation progresses, and then we'll address those questions at the end of the presentation. All right, Dr. Senick, I am going to hand it over to you and your presentation.
Great, thank you. And there is my click. Okay, do you see the presentation?
Yes, you're good to go.
Great. Well, good afternoon, everybody, and thanks for joining today. I'm really excited to share with you some of the progress that we were able to make with a Plan4Health grant from the American Planning Association, jointly administered with the American Public Health Association and funded by the CDC. This project ended now a good sort of 6 months ago, and so I'm going to sort of provide some off-the-cuff updates as I go along, and then look forward to taking your questions towards the end. Also, when I finish this presentation, I am hopefully going to be able to turn to a website where we have housed a number of templates and other toolkits and support materials that should be as applicable in Virginia or elsewhere as in New Jersey. And I think that website perhaps was shared before today as well. So I call this the co-creation of New Jersey's first health and food systems municipal master plan element because, as with really all planning endeavors, this is a multi-stakeholder undertaking. The video went through the team. The sound, I think, was a little bit wonky, so I'll just recap that the team comprised a number of folks from our Planning Healthy Communities initiative, which we used to call the New Jersey Health Impact Collaborative, here at our Rutgers-based School of Planning and Public Policy, with the chapters of the New Jersey American Planning Association and New Jersey Public Health Association and colleagues in the city of Trenton, along with the Trenton Health team, who really was very instrumental in this project and whom we look to be our sustainable element in that they are an organization of more than 40 non-for-profit organizations, all in some way with a mission of health. And whom you'll see as we go through the presentation, we've attempted to charge with serving as the organization that reviews the progress of the health and food systems element year to year. There were several objectives of the project. The development of the health and food systems element itself. One reason we undertook this project at the time that we did was because the city of Trenton, which is our capital city here in New Jersey, was undergoing a major review and revision to its comprehensive plan. So we were able to dovetail our efforts with the more considerable efforts that the city was undertaking at the time. In addition to producing the element, we really wanted to make sure that there were enough sort of supplemental pieces so that residents could engage and learn about the built environment linkage to health. And we developed a number of health literacy toolkits to that end, which I will show you briefly in this presentation and then point to on the website. As you heard in the video, we also included a health and all policies training, actually a series of training for Trenton city decision makers and departments. And that was really an interesting undertaking because it turned out we had people in the room on several occasions who said that even though they worked together in the city, they had not ever come together to discuss the relationship of the built environment and health outcomes. And statewide knowledge transfer, as you heard from Chuck Latini, our current president of our New Jersey chapter of the APA. And so similarly there, we have run many, many workshops, cross-training of planners and public health practitioners here in the state, and also produced an adoptable model health and food systems element for other municipalities that wish to follow suit. In undertaking this project, we were cognizant of research that has come before it by the APA and others on healthy plan making in the United States. And many of you are probably familiar with this project by the APA, which entailed a review of about 900, I guess, survey responses from local government planners about health in a master plan, or as most of the country calls it, but New Jersey, a comprehensive plan. And so of the responding local jurisdictions, approximately a third noted that they have comp plans that explicitly address health topics. The top 10 cited public health topics were recreation, public safety, clean water, active transportation, clean air, emergency preparedness, active living, physical activity, environmental health, and aging, really evidencing sort of the broad way in which health and planning are related. And there were two models for incorporating health into a comprehensive plan that were revealed through this particular survey: a standalone voluntary health element of some sort. It need not be a food systems element. It could be of another stripe. And then also the including of health-related goals and policy into existing mandatory elements of the comprehensive plan, or of course both. The APA then undertook a deeper dive review of 22 plans with health content. And the result of that analysis was that sort of the body of research evidenced strengths in active living. Environmental health was well covered, especially relating to water and trees. Emergency preparedness, when covered, was strong and specific in these 22 plans that were reviewed more deeply for their health planning content. Food and nutrition, when covered in plans, were strong areas with attention to equity and access for vulnerable populations, and health was emphasized to a greater extent when plans included a standalone element, and I'll comment on that more later. There were areas that were noted as in need of improvement. Most plans had weak coverage of food and nutrition, emergency preparedness, health and human services, and social cohesion and mental health. There was limited use of imagery and maps relating to health planning, limited use of public health data, virtually no health-related performance metrics, and most plans lacked specific implementation strategies. And so when we embarked upon this project, we wanted to try to take on some of those areas that have been either underrepresented or weak. And so we brought these areas to residents in several public events. In fact, it's probably noteworthy that our project really didn't include funding for a lot of public engagement. We were always counting on being able to ride on the coattails of what the city and its planning consultant were doing. And that worked out like reasonably well, but I think also fell a little short in terms of the level of public engagement we had hoped for. So we had about 4 to 5 such sessions as pictured here, where residents and other interested stakeholders were invited to come out and convey information to us, wherein we were one table of, say, 5 or 6 or even 10 other tables or booths relating to the overall comprehensive planning process, the Trenton 250 plan. And then additionally, we on our own, to supplement, had many sessions with the Trenton Health team and their 40 members as representatives and organizations that really have the pulse of the local population. So our goals in engaging residents were to identify issues and opportunities, and in fact, a rather lengthy issues and opportunities report was produced by the City of Trenton, which included what we found, and also just making sure that we were identifying and leveraging existing efforts. And so it was an opportunity for us to also find out if we were missing anything that was going on. And here we just have one of the exercises on the right, that we presented to folks who happened to come by our table or booth, depending on the particular event, to understand if people availed of local healthcare services, and if they did, how they got there, and from there, what the barriers and opportunities might be. The Trenton 250 plan was organized also around district plans, and to that end, we were also very cognizant to try and develop recommendations based on those geographies. Now, I want to spend a little bit of time, or maybe quite a bit of time, on the idea of health metrics and of how to cross-fertilize efforts of public health practitioners and planners. And I can't exactly ask you questions now, but I'll be curious to discuss at the end how many of you are familiar with community health needs assessments or community health assessments and correspondingly community health improvement plans. The two that you see pictured here, the China and the CHIP, are requirements of the Affordable Care Act and enshrined in IRS code and tax code, so hopefully they'll remain a requirement as we move forward across the next several years of change in the ACA. In any case, these are produced every 3 years, often at a county level, although it depends on what the catchment area is for particular hospitals who have this reporting requirement. And they're variable. Sometimes one can obtain from them very detailed information about a locality. Often one, again, is presented with county level data that may or may not be representative of the municipality in which one is working. Nevertheless, they are a regular source of health statistics from a public health perspective and also from a clinical perspective of a location, as well as recommendations for making improvements to those findings. In our case, these were produced or are produced by the Trenton Health Team every 3 years, which again, a coalition that includes the area hospitals. And so what we did in this project is we worked very closely with the Trenton Health Team to understand the information that was reported about the Trenton population in the Community Health Needs Assessment, to look there at the health determinants and opportunities for physical activity, healthy foods, access to medical services, healthy housing, and environmental quality, and to utilize metrics, and this is really where I should have put this in bold print, to utilize metrics identified by the Trenton Health Team through their China and CHIP in our health and food systems element, and our health element for the comprehensive plan. And so we tied directly into existing metrics, for performance metrics, that are reviewed every 3 years by the Trenton Health Team to build in that element of implementation and sustainability for the project. When we sat down to actually write the first draft of the health and food systems element, we had the following 7 goals on the right. By the end of it, we were down to 4 goals, which was actually a positive outcome because the material from the other 3 goals were directly absorbed into other elements for the comprehensive plan. And so I'm going to go through now the 4 goals we were left with, as well as while showing kind of how we mapped some related indicators. So one of the goals we were left with was to increase access to healthy foods. And in addition to the fact-finding events of meeting with members of the public and of looking through the background documents of the city, we also interviewed the directors of various departments and so on, and went through many of the measures that you well know as planners and other data sources. This map kind of summarizes both some of the challenges and perhaps highlights some of the opportunities. So as sub-objectives, we ended up with wanting to expand access to healthy food outlets, expand opportunities for community-based agriculture, support school-based initiatives that promote good nutrition, healthy eating, and use governmental policies, existing policies and programs, or perhaps those that were on the books, to increase access to healthy foods. And so to help us visualize this, We looked at what food outlets currently exist and distinguished between full-service grocery stores, seasonal farmers markets, participants in a Robert Wood Johnson Foundation-funded Healthy Corner Store initiative, and also where there were food pantries. And then we mapped out quarter-mile distances from those food outlets. Usually when we map quarter miles, by the way, it's not as the crow flies, but it's as one can sort of walk or get there by public transportation. We mapped rail transit and we mapped bus transit. And we use various sources as indicated kind of in the small print at the bottom there. So some census data, other New Jersey Transit data, some data from the YMCA, and there's a very strong branch in Trenton. A second objective, or goal rather, was to increase physical activity among Trenton residents with these sub-objectives: improving access to parks and recreational programming, improving conditions for active transportation, promoting physical activity through school-based programs, and using governmental policies, programs, and incentives to increase physical activity. And in the actual plan, those are obviously named in greater detail. And so here we mapped not only the planning district, obviously, but the park, existing trails, planned trails, bike trails, the DNR canal, canal access points. That's our Delaware and Raritan Canal, that stands for. Crime, which was not a pretty picture at all. Homicides, as well as aggravated assault with gun and assaults within 1,000 feet, with the bigger, the yellow circle there indicating more in terms of the legend. So that was actually a really challenging and somewhat depressing map. And then looked again at quarter-mile distance from physical activity assets with transit mapped as well. So, you know, you look at this map and you hear what residents tell you about it not being safe to walk to school or exercise, and it's unfortunately a very credible story. Our third goal, improve health literacy and access to healthcare services, meaning expand primary care provider capacity, expand healthcare access for children and adolescents, expand and integrate mental, behavioral, and substance abuse services in primary care settings, improve transit accessibility to healthcare facilities. We really heard that was a real problem. Promote non-traditional settings for healthcare services, such as in houses of worship, and some of that has started to happen in Trenton, and promote health literacy. And so here we mapped healthcare assets, again, distance to them, and mass transit means of getting there by the districts, so that our correspondingly more detailed recommendations could also be made according to the district plan approach that the city of Trenton took. And then healthy housing, address unhealthy housing conditions, create healthy and green building guidelines for new and existing housing. We left them with many suggestions. Improve the conditions of Trenton's housing stock to promote the health of Trenton residents, improve the conditions of vacant and abandoned properties, which is a fairly big problem in Trenton, that are health hazards to neighboring properties. And here we thought it was important to map known contaminated sites and then also emissions. I happen to do, I'm a climate scientist as sort of by training, I guess you could say. And I happen to do a lot of air quality work, so I thought it was important to at least represent emissions of facilities and sort of statements, and then also flood zones. You know, one tries to think through where are better or worse areas to site affordable housing, and this, like that kind of crime map we saw, shows that it's a bit difficult. In the situation of Trenton, there are a lot of known contaminated sites, and actually emissions are quite poor. You know, not represented there are things like particulates and so on, but we know from our other studies that the air quality in Trenton, in many areas of Trenton, is actually quite poor. So again, challenging, you know, where should housing be? Where should recreational facilities be? This is a population with disproportionately high rates of asthma, so all these things need to be considered in making recommendations as part of a health plan element. Increased health literacy is a really big goal of the Trenton Health Team, and so as you've just seen, we did pick up on that in making it an explicit goal of the health and food systems element for the comprehensive plan. And we also developed, with the help of lots of great student volunteers, a number of literacy toolkits in both Spanish and English. And again, I think I already sent around the website where those are located, but I'll point it out again in just a few moments. As well, on that website, you'll be able to find the extensive health and all policies training kit or PowerPoint that we used with the city of Trenton, and that you're welcome to borrow from or use for your own purposes. So we invited to that training the Department of the Administration, the Finance Department, Fire, Health and Human Services, Housing and Economic Development, Inspections, Law, Municipal Court, Police Department, Public Works Department. And again, it was a really good opportunity to bring people together who, even beyond the topic of built environment and health, don't always have that much to do with one another. And so we felt really positively about this piece of work. Here are some outcomes from this project. We developed the element, co-creating that with our partners, whom I've shown previously, as well as a model for New Jersey municipalities conforming with our municipal land use law, but I really don't think that there's anything in there that would make it impossible to adopt it in Virginia, although obviously that is something for you to look at. And I guess let me know, I'll be curious. I should mention that in agreeing to go back on the executive committee of the New Jersey chapter of APA, I'm going to be working over the next couple of years to bring a bill to our state legislature to include explicitly the health and food systems element, or a health plan element, in the municipal land use law. I did lead a similar successful initiative many years ago now regarding a green building and sustainability plan element, and I'm optimistic that in the future we'll be able to specifically reference a health plan element in our municipal land use law here as well. In addition to our not just borrowing, but really agreeing health metrics in common with the Trenton Health Team and reading those directly into the health plan element and thus the comprehensive plan, in return, or really at the same time, the Trenton Health Team has now updated their community health needs assessment, naming land use planning as a new focus area and making explicit reference to some of the more detailed strategies and actions from our health plan. So again, a really good cross-fertilization in training and health metrics and in institutionalization of objectives and strategies and actions. And then, of course, there's been a lot of training of next generation of planning and public health practitioners at the New Jersey American Planning Association, actually also at last year's National Planning Conference in Phoenix, and we have a session in New York City for the forthcoming National Planning Conference. We've given training at the New Jersey Public Health Association meetings and several other ones that have been sponsored by the American Planning Association for the newer round of cohorts in the Plan4Health grant, and probably other places that I'm not remembering. We were able to provide a number of student internships and give various guest lectures in a number of classes here at Bloustein and then also in other departments regarding this project. So we tried really, really hard to disseminate this project pedagogically in academia, professionally, through practitioners, and of course in the city of Trenton. Subsequently, the Trenton Health Team was awarded a major 5-year grant by Trinity Health for lots of reasons, to build on collaborative efforts that go beyond our involvement, but also towards improving the health and well-being of the Trenton community based on the specific goals and objectives that were inscribed in the Trenton Health Plan. THT was also one of 15 finalists for the 2016 Robert Wood Johnson Foundation Culture of Health Prize, where they were able to talk about this project during their on-site visit. And the Trenton Health team is continuing to share the experience of co-creating the health and food systems element as an evidence-based collaborative approach of health planning with its constituent nonprofits and their members. So that's the end of the, we'll call it, formal part of the presentation. And I'm now going to make an attempt to get out to this website and see what happens. So far so good. Okay. So again, I'm quite sure I sent this link, but if not, it's right here in the presentation, which I understand will be put up on your website. And this is the page for the project that is sponsored by the overall Plan for Health Project of the APA. So it talks a little bit about the project. And then in blue here, if you click on these, which I'm not going to do now, you'll be linked to the final deliverables, as they were called here, and some of the resources. So this is the general element that perhaps will work in Virginia. This is the one that was developed specifically for Trenton. I should mention that this is what it was when we delivered it to the city of Trenton before it was put out for the last round of public comment, which is still going on now, I believe, and so there will be some additional rewrites. This is a physical activity toolkit. There's a healthy eating toolkit, a home literacy toolkit, also a number of activities that are oriented towards grade school aged kids. This one right here, The Adventures of Danny J. Dorth VOC versus Indy IAQ, I thought was really brilliant and was an independent study by one of our MCRP students pursuing, therefore, their master's in planning. And then just more information about the team members. So let's see, it's 12:33. I'm probably running a little ahead of schedule, but that gives us more time for questions. So I think I will stop there for now and see if we can have some conversation among us. Thank you.
Do we have anyone? Thank you, Dr. Senick. Do we have anyone who has any questions? You either have the option to type it in, or you can click the raise the hand option, and it will alert us in the attendee box. So if you have any questions, please let us know. We'd be happy to answer them. All right.
If there are no questions, maybe I can ask a question and somebody will answer it.
Sure. If you want to ask a question, if somebody has the answer to it, again, if the attendees would just click the raise the hand button and we can unmute that so they're able to answer it. So go ahead, Dr. Senick.
Yeah, I would, I'd be curious if any of the attendees have direct experience in drafting or participating in some capacity in the creation of a health plan element for a comprehensive plan in Virginia or elsewhere. I realize some people may be from national firms. And I guess if so, how long it's been in place and if they've been able to evaluate any results. Yeah.
So if anybody has an answer, there we go. We have George Homewood, who is the president of the APA chapter. Thanks, George, for your comment. Congrats and thanks for volunteering to serve on the APA New Jersey chapter board.
Oh, thanks. It's one of those labors of love, right?
Absolutely. So it doesn't look like, let's see, hold on. It doesn't look like we have anybody else that's acknowledged at this point. Let me see. Nope. So again, if anybody has an answer to Dr. Senick's question, please let us know. And then if not, again, the handout, the PowerPoint presentation that Dr. Senick went through is available to all the attendees in your handout section. And this is being recorded and it will be posted to our YouTube page, which I showed at the beginning, within about 24 hours. And then if anybody has any questions regarding CM credits or webinars in general, those questions can be sent to admin@apavirginia.com, admin@apavirginia.com. Again, Dr. Senick, thank you. We will make sure that all your contact information and these links as well are posted to that YouTube presentation in case anybody has any follow-up questions for you. Do you have any closing remarks that you want to wrap it up with? All right. Well, I will end the webinar here. Thank you, everybody, for joining us, and we'll see you next month on March 27th at noon for Carson Bice's presentation. Oh, wait, I believe we have one more question that came in. We have a couple thank yous for you, Dr. Senick. So thank you guys for participating, and we hope you have a great Monday. Thanks so much, and thanks again to the Berkeley Group for making this possible.